Well, if you saw the TEDx talk of my next guest, I bet your mind was blown away too. And today we're speaking with Annette Verpillot. She is a posture specialist, and she's going to explain exactly what that means. Now, she's also the founder of Posture Pro, and this is a health company specializing in restoring the brain body connection through some of the world's most advanced rehabilitation and injury prevention techniques. Now, she created an incredible technique to eliminate, yes, completely get rid of chronic pain. And it can also increase your strength and improve your athletic performance through what she calls the Posture Pro method. Now, Annette has not only been speaking on the international circuit, but she still actively works with clients of all ages and professional athletes and trainers and practitioners and researchers to develop solutions to tackle serious global health issues. Now, before I introduce Annette, I want to read the fancy disclaimer. Now, all information is strictly linked to the topic of postural health. Although our recommendations can provide relief for various symptoms, please note that they do not serve to replace or substitute professional medical advice, diagnosis, or treatment. So now, without further ado, please meet Annette Verpillot. Welcome.
Thank you so much for having me. It's a pleasure.
It's our pleasure too, and I'm so excited to share your method, your experience. But before we do, let's talk about what is a posture specialist.
In a nutshell, it's someone who will look at the different parts of the body that make up who you are today, as far as your posture, as far as your thought process, because everything is intrinsically linked together. So, most conventional therapies tend to focus on looking at a specific part of the body to resolve the problem. I have a background in rehabilitation. I did that for many years, but one of the things that I had to tackle with along the side of my career was the question of why I was not able to resolve the problem on a permanent basis. It was management and I was producing results, but I was not able to actually fix the problem. So I come from a background of neurosurgeons in the family, and I always remember my uncle saying to me, Annette, the brain controls all. And it's something that resonated with me for my entire life and got me into looking into the brain to resolve musculoskeletal problems, which is essentially what I did. And so looking at different body parts to be able to address the root cause of a problem, usually chronic pain, which most often stems back to someone's posture, which is not something that we're accustomed to thinking. When we think about posture, we'll think, oh, let me stand up straight. Let me just make sure that my knees are aligned and whatnot. But I'm talking about the unconscious part of your brain that controls muscle tone. That's really what we kind of dive into when we're talking about posture, because that's really that's at the root cause of muscular energy and energy expenditure. So in other words, the least amount of energy that you waste, the more energy you have at regular bodily functions, and just preserving your energy and recycling your energy on a daily basis. So in a nutshell, looking at the brain in the context of pain and using body parts to help organize the brain to have an effect on pain.
Yeah, that makes perfect sense, actually. And it's something new. And I think that's why it's super intriguing, at least new for me and a lot of people, because like you said, we have a pain, we see a traumatologist or a physio, and we focus on that knee or that shoulder, whatever it is. And we may have some resolutions, but then we're always back. There's always something. And the older we get, then, it just doesn't seem to last as long. We just keep going more and more often until a doctor says, okay, go get a surgery. And I think there's time for surgery, and there's times that, well, maybe there's another solution, right? Surgery for me is always like the last resort. And there's a whole spectrum, and there's a lot of things that are in there in between. A lot of people, unfortunately, do not look at what's in between, because you see a doctor, they say need surgery, and then you trust them, and then you go and you do it. You don't really question it, which I think is a big mistake. So I think people out there should really question a little bit more. But if I understand, if I got this correct, you were in rehabilitation, like you were an osteopath or physical therapist, or how does, and then you kind of transition, you said you put the pieces together as that.
Yeah, exactly. I was in osteopathy school, and I had a client that basically had shoulder pain. I was doing what I was taught. I was all of the different details and things that you have to go through to assess the joint and range of motion and whatnot. And she just turned around and said to me, how many more sessions, and why are we not able to resolve this problem? So in that instant, I felt quite silly, because I didn't have an answer, and here I was getting paid for my time, for my professional advice, and I was just not able to. I just didn't know. So Lord and behold, I went back, asked my teacher, and I said, why is it that we're not actually able to resolve the problem? And the answer that I was given was something that doesn't really go with my personality, which was, we really don't care, just do what was taught in school, and just manage and look at range of motion as you were taught in class. And I was like, but what is causing it? This was not an accident, this was not from a traumatic injury, this was just regular shoulder pain. So that's kind of what got the ball. That's what got the ball started with this whole brain-based approach, as far as being able to incorporate the nervous system into the context of rehabilitation. And when I started doing that, the results that I was getting were really at the speed of light, because the speed of the nervous system is 114 meters per second. So when you're actually improving sensory input to the nervous system by using specific body parts with a healthy individual that has a healthy nervous system, the response, the motor response, is very, very quick. And that motor response is usually associated with a realignment of the shoulders, a realignment of the hips, better stability, a change in the sagittal plane. And all of these factors play a role as far as the tension and the pressure on every single joint in our body. And it just turns out that when someone has pain, there's always an imbalance with their posture. And if there is an imbalance with their posture, there is always an imbalance with the two extremities of the body, which happens to be the feet and the eyes.
Oh, this makes perfect sense. I just love this. So it's incredible that you put these things together in the sense, like, why aren't more people doing this? Because I can imagine the frustration as a doctor, thinking you want to help you generally want to help people. And then you just see them coming back and back. You're like, well, what am I doing wrong? Or why isn't this lasting so long? So thank goodness we have people like you saying, okay, there's gotta be another way to get this person really, really resolved. And so one of the things, okay, you said starts with, there's the head and the feet, right? The top, and this is what we're looking at. And so this is what I saw in this TED Talk where I found you, and it was incredible. It really blew my mind. And you invited somebody up to the stage, and you shared some simple eye exercises, and that brought immediate pain relief to that person. And so this method that you've come up with, I've never heard before. It makes sense. So, please share a little bit about what you did in with these eye movements, and how the nervous system can improve our well-being. So people who haven't really seen that, I will have a link to that TED Talk in the show notes too, so people can go watch that.
Thank you so much. Yeah, so in a nutshell, as humans, what makes us humans is the fact that we're able to walk on 2 feet. We're the only Homo sapiens that are able to do this, aside from the fact of being able to speak and write. But the organization of movement happens throughout the course of 12 months. It takes 12 months for a baby to walk, in comparison to, let's say, a giraffe who will walk within 5 minutes. A distinct difference between the two is in the organization of the nervous system of the brain, in essence. And when you start to look into that and dive into movement a little bit more with humans, you realize that what starts off movement with a toddler or a newborn baby, which then becomes a toddler, is sensory stimulation. That sensory stimulation goes into different parts of the brain that, for lack of a better word, sends out these neurons, these connections that will myelinate or will mature or thicken, so that these impulses can go to the higher stage and the higher stage and so on and so forth, so we can have access to our entire brain. And that happens throughout the course. The first milestone is going from 0 to a month and a half, to 2 months and a half, 2 months and a half to 5 months, 5 months to 7, and so on and so forth, up to the age of 8 years old. So the feet are fundamentally a huge part of our stability, because we walk with our feet. But when you look at the way that the nervous system is organized, the foot is composed of skin, muscles, and bones, and all of which go to different parts of the brain so that we can feel what type of ground we're walking on. But as humans, we have a slight disadvantage being at the level of our ankle. Our ankle joint is actually propelling us forward. It's 3.4 degrees actually of forward displacement that all humans have. And we rely on our back muscles, on our extensors, to hold us upright and to be able to fight gravity efficiently. So what we do is that we kind of break down to see where, we work with a method that works by process of elimination. We would like to know what is causing the imbalance. We know the foot can cause an imbalance, because if there's an imbalance with the weight distribution, it's going to affect every single joint in your body, starting from the ankle all the way up. And it's also going to have an effect on your stability, because your balance is picked up by a very important organ embedded in your skull, which is called your inner ear. So if there's an imbalance in your foot posture, there's going to be a mechanical problem, but there's also going to be a problem in your brain. And there's going to be competition between those two sensory entries within your nervous system. Your brain is going to try to pick the information, the most important information in regards to your stability. And at that point, if that information is contradictive, then you end up creating postural compensations, which over time can lead to joint degeneration and eventually pain. So how to come up with this information? Well, you just simply, by looking at the way that humans organize movement, feet, eyes, inner ear is a component. And another twist that I don't talk about in my TED Talk is looking at the jaw. The jaw is basically an important component of stability. More and more studies are confirming that postural stability is also affected by the jaw. So we call these different body parts sensory receptors, because this is exactly what they do. They take sensory information from the outside world and they bring it into your body, into your nervous system, so that you can make the appropriate decision to move and walk and live. Now, the challenge is going to be fighting gravity efficiently. Someone who has a forward displacement of their center of mass will always waste more energy standing upright. As a matter of fact, one of the things we just demonstrated with the state of Massachusetts is that when we actually bring somebody's body weight back very slightly, we have an improvement in blood pressure. And we had this measured by MDs when some of these guys were on blood pressure medication, and we were actually, and we're able to get these results also with high level athletes. So whether you're in the later stages in your life or earlier stages, there is a positive effect. And it kind of makes sense. I mean, the calf pump, the heart just does not have to pump as much to bring the blood back up. So this is a process. I'm still learning. I mean, this is a process. I think it's a lifelong process. Started off in 2004, started applying these concepts and having amazing results and feedback and testimonials from people from different fields, whether they were elderlies, Parkinson's disease, baby boomers, kids, teenagers, athletes, or whatnot. Every single person is responding in the same fashion depending, of course, on where they are on the scope of health. If Parkinson's disease will be different, but they will still have alleviation from, they will still feel a relief from the treatment.
This is incredible because you didn't, I see on your Instagram talking about the jaw, that was very interesting. And I have a question about TMJ or TMD, some people call it. But when you're talking about the forward motion and just moving these people back, bringing their posture back to improve their blood pressure, it reminds me of skiing. Actually, I'm not a skier, but I remember when I ski and the instructor, I'm always hunched forward and freaking out, I'm going to fall. And then they say, no, just put yourself back. And you think, but then you feel like you're going to slip. But I guess there must be some better balance with skiing. If I don't know if you're a skier or if there's skiers listening here, that's what it just made that connection.
It's just that every single muscle in your body is wired to respond to threat, and falling is a threat. I mean, if you fall down, you'll hurt yourself. So there needs to be an automatic mechanism in your brain, in your nervous system, that will automatically, without you having to think about it, will automatically contract those muscles so that you can catch yourself back up. And that mechanism comes from your inner ear. Actually, it actually comes from nuclei and parts of the brain that we don't control, in the same area where digestion and heart rate and breathing happens. So the therapies that are available to us today in the 21st century, and I'm not saying that they're wrong, I'm just saying that they're incomplete because they don't take into consideration that involuntary system, which happens to be the brainstem. I mean, the eye muscles feed right into the brainstem. The vestibular, the inner ear, feeds right into the brainstem. The foot doesn't feed into the brainstem. It feeds into your sensory cortex. And there's some part of this information that goes into your cerebellum, which again, connects to your inner ear. So we can use these different body parts. Your trigeminal nerve, your jaw, feeds into the brainstem. So when you use body parts that stimulate, activate your brainstem, this is where you'll get the greatest results as far as therapy is concerned, and certainly as far as chronic pain is concerned.
So then to go back to the TMJ, because I can understand the eyes. Like if you try to stand on one foot with your eyes closed, you'll find it harder generally than if you had your eyes opened or something like that. But the jaw, and that's something I'm still trying to understand, like how would you, so you're saying that by doing something that's influencing the jaw will give you better posture, and then through better posture, you're going to be relieved of pain?
So the formula is always the same. What I mean by that is when we talk about the jaw, one has to consider that there's 4 components that play a role. There's the actual joint. There's the lower jaw, which is the bone that is attached to your skull and maxillary through muscles. There's the teeth, and there's the tongue. So for example, if you have the lower jaw that is too forward or too back, which is either a class 2, a class 3, or a class 2, these are dental terms, what that's going to do is that it's going to change your head posture on your shoulders. The moment that happens, your center of mass, which can actually be measured really precisely on force plate, your distribution, the distribution of your body weight is going to change. Gravity passes through the head and through the body of L3. So if my gravity changes, that center of mass changes with it. Hence, I'm wasting more energy. If I'm clenching my teeth on a daily basis because I'm stressed, and usually when we're stressed, we do clench our teeth, not when we sleep. We do clench our teeth when we sleep. This is physiological. But if we clench our teeth throughout the day, what we're doing is that we're constantly overstimulating the cranial nerve that innervates the jaw, which is the trigeminal nerve. Think of it as taking an axe and just slamming it into a breaker box where there's electricity. This is what we're doing to our nervous system when we're clenching on a daily basis. This is what's happening in our brain. So how can this create pain? Well, it could create pain because, one, the trigeminal nerve talks to the inner ear. They communicate together. It could create pain because it's going to push your body weight forward. And an easy way to test that is if you simply just stand up straight, look straight ahead, and consciously bring your entire body weight forward. Don't bend your hips, stay straight, keep your feet on the ground. You'll feel pain happen pretty quickly. If you have lower back pain, you'll feel lower back pain almost instantly. That's energy expenditure. And it goes all the way down to your foot. It's going to affect your calf. It's going to affect your toes. It's going to affect your knee, your hip, your lower back, all the way up to your head. And that's stemming from the jaw. So most people are in a class 2 occlusion, which is basically when the joint moves down and forward.
Okay.
Stats are actually around 85% of the population have a somewhat of a class 2 occlusion. It's also called an overbite. When you look at your teeth from the front, if the upper teeth cover the lower teeth by more than 1/3, that is a class 2 overbite occlusion. This pushes the head forward. Now, you can also have a crossbite when the lower jaw moves to one side or the other. Well, what that creates from a postural standpoint is torsion. Now, because the jaw affects the inner ear, it also affects the eyes. So if you have an imbalance with your jaw, you'll have an imbalance with your overall stability, but you'll also have an imbalance with your eye muscles. If you have an imbalance with your eye muscles, the way that you're going to move, the way that your foot is going to land on the ground will be uneven. And if you have what I refer to as a mixed foot, for example, one foot pronates, the other one supinates, then you will have biomechanical compensation in every single joint in your body, starting from the bottom up and from the top down. Because every single joint in your body is located between, guess what? Your feet and eyes.
Yes, that makes sense. You actually, you've described it in other podcasts wonderfully to people who like cars, right? You describe a Ferrari, and if you have an imbalance in one of the wheels, it's, even if it's just slightly, the cars will run, but it will not be optimal or efficient. You're certainly not going to win Formula One, right?
Well, that was in the TED Talk. They had to, they kind of wanted to come up with a really simple terminology, and I think that one did it. But yeah, it's exactly, that's the simplest way to understand it, is if one wheel is misaligned, the car will eventually break down.
So you mentioned something about eye imbalance, right? How do we know if do we know this, our eyes imbalanced, or a lot of people don't realize that their eyes are unbalanced?
Yeah, so as far as the disclaimer is concerned, I just want to clarify that I'm not diagnosing eye problems or refraction disorders. What I'm looking at really are the movements of the muscles of the eyes. And most professionals in North America are more concerned with binocular vision. So ophthalmologists and optometrists will give lenses for refraction disorders. What I'm looking for really is an imbalance with the eye muscles, which is what is referred to as a convergence insufficiency. And most professionals in North America are not looking at this. And this is a mistake, because from a partial, well, it's not really a mistake. I mean, their scope of practice does not allow them to really, make the links between the eyes and posture. This is where I think being a posture specialist, looking at the body globally, really gives you a different perspective in regards to what's really going on when we're talking about chronic pain. So simply just grabbing a pen and asking someone to look at the tip of the pen will give you a pretty good idea will give you a window into their brain. Because of their eyes, vision from one eye goes into the opposite side of the brain and vice versa. I mean, it does stay on the same side, but most of it goes to the opposite side. And that's going to have an effect on the other side of the body. So if the angle of my right eye is not the same as my left, when I'm looking at something, whether it's close or far, my entire body is going to react and respond to that. Furthermore, the muscles of the eyes in the brain borrow exactly the same pathways of the intrinsic muscles of your spine. Those little muscles that we train when we do yoga and Pilates, those muscles respond to the commands of the brain. So if you have an eye imbalance, you'll have an imbalance with the intrinsic muscles of your spine. Your erector spinae will not be cannot be aligned in the same respect, left side, right side, front and back, if there's an eye muscle imbalance. So one issue with a sensory receptor creates 10 problems. There's going to be, especially specifically with the eyes, because the eyes do affect 100% of your brain. This is what neuroscience is telling us. It's going to have an effect on your hormone production. It's going to have an effect on your sleeping and melatonin. It's going to have an effect on your ability to manage your stress. It's going to affect the way that you understand what you read. It's going to affect your posture. It's going to affect your spine, and so on and so forth. So, I mean, the eyes affect 100% of the brain and is the only organ that functions at 100% at every given moment in time when you are awake. And we actually do over 100,000 eye movements per day. So if there is an eye imbalance, we're constantly reinforcing that imbalance simply by looking and scanning our environment.
Yeah. This is the brain overload. I can
Well,
see.
I don't even, one of the symptoms, I don't think it is a brain overload, but the first symptom associated to the eye would be tiredness or pain in the second part of the day.
Ah, interesting. So would something as simple as meditation help something like that? Closing your eyes, giving the
Well,
break?
it's definitely going to give you a break for sure, but it's not going to fix the diverging eye. So everything helps. Remember, everything helps. But what we're talking about here is, what if there was a way to actually have an effect on posture and correct it almost instantaneously and permanently? And this is why I recommend doing eye exercises as part of your daily routine, as you would your meditation and your stress and, and eating right, taking a minute to a minute and a half per day to just relax. You feel tired, take a break, sit down, sure, do your meditation, but, add to that some eye exercises, simple eye exercises. Don't clench your teeth, take a moment to be in the moment, work out your eyes. And more often than not, the person does feel a sense of relief, not only from pain, but also from stress. So it's a really quick and efficient way to kind of reset your brain.
So these exercises, I saw some of them in your TED Talk. I saw some of them on your Instagram, and looking up for 5 seconds, looking down for 5 seconds, right, left. And so, yeah, they are very, very simple. So I was doing them this morning as I was walking along the beach, but I don't know. I was thinking, should I be doing this when I'm just standing, sitting, walking? Does it matter?
Well, we recommend doing them sitting down, because simply if someone's unstable and they're doing eye exercises, or if they're driving a car, it's actually happened. And I'm like, please don't do that. No, please be immobile when you're doing your eye exercises and not in a moving vehicle, please. So no, if you can, ideally in a sitting position, in a relaxed state, ideally not clenching your teeth. Really, that is really important. Your teeth should not be in contact. The teeth should only touch 12 minutes per day.
Oh, interesting. Why the magic number 12?
Oh, 12 to 15 minutes. This is what science is telling us. This is not what I'm coming up with, but dentists are actually saying that anywhere between 12 to 15 minutes per day is the amount of time that it takes for us to chew our food. All the other time, there should be no contact. There should be a free space between the teeth. You'll notice that most people clench their teeth. When you talk to them, you'll see the masseter that's actually popping.
Yeah, I've seen that.
Yes, so that's clenching, and that has an effect again on everything that we've just discussed. But
so, okay, let's talk about a woman in her 50s, 60s, 70s, or their parents in their 80s and 90s. And keeping a woman in context, by the time you get to our age or those ages, you've got hip pain or shoulder pain, back pain. It seems to be something very common. I don't know if it's normal aging, but it's certainly very common. Do you believe that these are due to these imbalances you're talking about, or wear and tear, or chronic inflammation, or all of the above? What is the reason for all of this pain that happens? It's one of the biggest complaints we have as we age.
Um, what did it start off with? It always starts off with the sensory receptors. I'm going to exclude trauma and accidents of things we can't control. Just natural aging, we're all decaying by the minute. Our nervous system will ages with time. We age, we have, you know, we get white hair, we get wrinkles and whatnot, but our internal organs and our brain does age. So being healthy is about what can we do in our daily life to delay aging or to age as gracefully as possible. It's never too late to start. I'll give the parallel or the example. Someone is out of shape, they're 55 years old. Should they start training if they want to get in shape? Absolutely. Right? I mean, there's no counterindication to just regular exercising and promoting a stress-free life and eating well. This is kind of the same thing, but it's never too late to start. Where does pain begin? If professionals were looking at these imbalances in these sensory receptors, I believe that pain would be very different in the 21st century. The problem is that we've separated the body into different pieces. You have the foot specialist, the eye specialist, the dentist, and the muscle specialist, but none of them are really talking to one another. The body is a global entity. Everything, the foot affects the joints, the eyes affects the joints, the eyes affects the foot affects the eyes. There's actually studies that say that weight-bearing surfaces on the feet affects the way that our eyes are moving. The jaw affects your posture. So where does it begin? I believe that it begins with an imbalance in the sensory receptors, and it starts with primitive reflexes. How did we learn how to move as babies? What type of movement did we learn afterwards? And what did we build on top of that? Because every single child that I see has an imbalance. Wow. They have primitive reflexes that are not integrated. I'm talking about 8 years old. I even see it in older men. I just posted a video of a 32-year-old man that still had a palmar reflex that was active. He's 32.
What's a palmar reflex?
Primitive reflexes are basically automatic reflexes that are embedded in our brainstem. Every single human has them. And the goal of the nervous system is to inhibit the reflex. So a palmar reflex in a baby, and I'm sure you've seen this, is when you put your hand, this is a newborn baby, you just touch their hand, they go into flexion.
Yes.
This is a palmar reflex.
He still had that at 32?
Yeah. So if you take a pen, and
that's crazy.
It was but I see this all the time. Now, here's the thing. If we talk about performance and movement, the palmar reflex, when you stroke the hand, it shouldn't even feel ticklish. And this guy was going poop, like this little poop.
Oh, I saw that. Yes. I saw that what you posted.
Okay. So with that reflex, the integration of this reflex is actually connected to our mouth. You've seen kids write like this.
Yes, my husband does that when he's focused on something.
So that's
why is your tongue out like a kid?
Yeah, so that's the palmar reflex. Hand and mouth are connected in the brain. So to learn fine movements, the development of the finger, there's different stages that children must go through, and because some of these stages are skipped as babies, we become adults and start building layers and layers and layers of postural adaptation. And this is where pain comes in. Wow. Because at some point, depending on our lifestyle, how we eat, our stress level, I mean, there's a million variables, obviously, that we can't control. Eventually, pain sets in. But here's what we know. We know that if we address the foot and the eyes, just the foot and the eyes, not the jaw, just the foot and the eyes, we should expect a decrease in pain anywhere in a healthy individual, anywhere between 60 to 85% in one single session.
Oh my goodness. Okay. Everybody wants your number now. That's what we expect when we go to an osteopath or
do we really? Because a lot of the people that I talk to, unfortunately, are just accustomed to this pain management. It's kind of this thing that we go into. Oh, let's manage pain management, and it's kind of again, not to say that it's wrong. It does help, but it doesn't fix the cause.
You get tired of going and over again, and you get tired of spending the money too, especially if you don't have insurance that covers this. So, and that's where I think some people break down and say, you know, I'm just going to get the operation, because you get tired of doing that. So, that's where I'm asking, the root cause of that. Okay, the posture imbalance. I start with the eyes, start with the feet. No, but I'm like you said, there are probably a lot of other factors with the woman over 50 or going through menopause. Let's say there's probably a lot of hormonal imbalances happening as well that's influencing some of their pain, or not. What are your thoughts?
Well, yeah, absolutely. I mean, when you go through menopause and you stop producing estrogen, the organ that is going to start producing or should start producing the estrogen instead of your ovaries are your adrenals. But if you are in constant pain, you have excessive cortisol floating through your body excessively, and it becomes chronic. So at that point, what will end up happening is the hot flashes and just going through that menopause period might be harder for women to go through once or if they are in constant chronic stress or chronic pain. So remember that the step one is really simple. The method is common for all. Is look at the imbalance in the foot. Is there an imbalance with the eyes? Let's restore proper connection between the feet and eyes so that there's no competition in the nervous system. Let's restore center of gravity. We'll talk about the jaw later, but let's just start with that first and see how you feel. And usually, very frequently within the session, you'll have a decrease in that pain.
Interesting. So, okay, we got to figure out, I've got to get and learn a bit more about these eyes and other feet, because the posture thing, I think we all get it, right? When you're having good posture, we have heard it, I'm sure I've had my mom, pinching my shoulders back, telling me to sit up straight. Now I have my husband doing that. So it's like, you have these cues all your whole life. And we know, and people probably listening to this podcast now are just sitting up a little up straight and trying to get the pelvis in. But that's the conscious mind telling us it lasts for about 5 seconds and then we relax. And so how are we supposed to correct our posture, in a conscious state? And this is where I find your work intriguing, because it seems as though you're tapping into a subconscious state, which makes more sense, because it's not what we do that 1 hour in the physio that's important. What was happening the other 23 hours of the day? How are you correcting your posture or moving in a way? Because I think it's those movements. It's what you do every single day that makes a bigger impact than what you do once in a while. I mean, for me, across the board, it just seems like that's the way it is. So how is your technique tapping into that subconscious mind? I mean, because you say you're working with the brain, you're working with the eyes and the feet, so that we can be in this, just subconsciously be in the correct position to remove our pain.
Because some of the sensory receptors that are being targeted are sending sensory input directly into our primitive brain.
So it's just a one-time deal. You say, let's.
Oh no, it's not a one-time deal. Again, it depends on several factors. Are you taking medication? Do you have Parkinson's disease? Do you have cancer? Do you have Alzheimer's? I mean, all of those things will play a role. But again, speaking with from the perspective of a healthy individual, the results are very quick and can last anywhere between 4 to 6 hours. Now, they have to be repeated for a minimum of 6 weeks. Why? Because if you have rounded shoulders, for example, if you find that you have poor posture, this is something that you've developed through time. No therapy in the world will reverse the rounded shoulders in an hour. It's impossible. The gap is too big. The fascia have adapted. The muscles have adapted. So you need to give time to time. What's that time period? Well, you need to repeat good posture for a period of 10,000 hours. In the equivalent of days, that comes out to being 6 weeks. It also takes 6 weeks for neuroplasticity in the brain to occur. Neuroplasticity is forming new neural connections, new habits in your brain. So 6 weeks is the mark that we aim for. So for 6 weeks, we ask that you do eye exercises, foot stimulation. It's going to cost you 3 minutes per day at the most. 3 minutes per day. For some, we do work with different therapeutic tools. We do work with postural insoles that just speed up the process. I always love to offer free solutions first so people can try out for themselves to see whether or not there's a benefit. Most people usually feel such a benefit from doing those simple exercises that very often they do tend to want to buy the products because it is costing them time to do these exercises, although they are the ones that are the least costly as far as results. So you're basically just going through a different system when you're doing eye exercises or even foot stimulation. Whereas working on the muscle and the muscle alone, you're bypassing the brain. You're simply working with the segments of the spinal cord. I don't know if that makes sense or not, but working with the nervous system is always going to give you longer lasting results.
Okay. So that's super interesting because the insoles I can understand a little bit better because I think 3 minutes a day, that's nothing. And how is that going to make an impact? But the insoles make sense because you're walking every single minute of the day practically, or maybe not, maybe you're sitting a lot, but you're probably doing a lot more than 3 minutes a day. And so one question I have before, because it's on the top of my head and I don't want to forget. So what you're saying is a healthy individual, generally healthy people don't have Parkinson's or cancer or have a serious injury, spinal cord injury, for example, they will heal a lot faster than those people who are unhealthy, right?
There will be a response of the nervous system much faster than the ones that are unhealthy.
Okay.
A response, because remember what we're doing is we're looking for a response. If I take a cigarette and I burn you, how long does it take for you to feel that? You're going to have a response, a withdrawal response to protect yourself from the burn. But the sensation is coming in through your skin. So we're wired in such a way that our muscles respond to stimulation, and that response, that delay in feeling the burn, happens in your brain. So if we can use the same mechanics, but under the foot, because we know that in the strip of the sensory strip in the brain, the foot, the mouth, the hands are occupy a much larger space than, for example, my elbow, right? Then we can use that information to our advantage in the context, in a therapeutic context, or certainly in the context of rehabilitation or pain management.
Interesting. Okay. So then would the same be for somebody who's in their 40s or 50s, probably go faster than somebody who's in their 80s or 90s, assuming they're generally healthy on both spectrums? I mean,
I'm going to want to say that the 80-year-olds, it's much more noticeable for them because they've really started to break down. So just that small adjustment, you literally, they describe it as giving them like just living again. When you're old, what happens? You're afraid to fall. You don't like to move too much. The floor might seem uneven to you. You're afraid to fall. I mean, we know that what kills the elderly is falling.
Yep.
It's not old age, it's falling.
Yeah. That's true.
Why? Because they have calluses. They no longer, a lot of them have type 2 diabetes. We know that affects the sensory receptors in the foot. They no longer have that stimulation, that sensation of the ground. Their eyes are not tracking properly. They're a mess.
Interesting that you say that. Yeah. So you're saying that they have quite a quick response or dramatic response.
Much quicker than someone that's young. Much quicker. I mean, for them, it's much more noticeable. They're like, wow. Whereas, I mean, you take a 50-year-old, sure, they'll respond faster, but for them, they'll be, yeah, I'm good. Of course, it depends. I mean, it depends who comes into my office. If you can't walk and you have massive back pain and then all of a sudden you can stand up. But, it just, everyone's different. Everyone's brain and nervous system is different. I've seen both.
Interesting. So you're right. Actually, I was thinking because by the time you reach 80, these habits, these imbalances, you've been carrying them possibly since childhood. So I would think it would take so much longer to reverse the damage but what you're saying is not necessarily so.
Well, my God, with a 75-year-old, and I have this picture on my Instagram, he literally went from a flexed forward posture. No, really, I mean, these are real life pictures to boop, like he grew by 2 hands simply by stimulating his feet.
Wow.
So what happens to the brain when you age, again, the brainstem, the primitive brain, is we're born in flexion. We have to learn to inhibit flexion and activate extension as humans. When we age, we go back into flexion.
Yeah.
And this is why we have this kind of captocormic, this flexor dominant type of posture. When we age, we see old people that are always hunched forward because their nervous system is aging.
Yeah. Interesting. Okay. So let's talk, because we don't have much time left, and I want to open the mic to Luke, who's here. So how you just said something about stimulating the feet. Describe, somebody who's listening now may say, okay, I got to try this method. You're in Canada. Well, today you're in France, but no, generally you're in Canada. So how does somebody actually see you if they're halfway around the world?
Yeah, so we offer online consultations. So we can still get really, really good results with the online consultation. Ideally, in person is always best, but through online consultations, we can have already drastic changes in pain or whatever issues you may be struggling with. Now, to try it, I mean, with the foot is really simple. Like I said, I love to give tools that are free at first, so you can try it out. What I love to suggest is if you do have pain, is to put a number on that pain. I don't know, let's say shoulder pain or back pain. Give me a number. How much is it out of 10? 10 being the most, 1 being the least. Are you restricted in movement? If so, please do the movement and put a number on that. Then sit down and do some eye exercises, just like I did in the TED Talk. Relax, make sure your teeth are not clenching. Go slow. You have to go slowly. Most people go fast. It's a mistake. Small circles and slow. And you have to see one target, one line throughout the entire exercise. Do this for 45 seconds. Reassess your pain. Did it change? Yes or no? If it changed, it means that your eyes are contributing to your pain. It means that the eye imbalance is causing an imbalance in your muscles. So you should do those exercises, and you should do the same thing with the foot. The foot, something as simple as a pen, as a fork, just rub the skin of your foot. Rub the skin of your foot. And again, reassess your pain, yes or no. And you can try this on 2 different occasions. I don't know, Tuesday you'll try the eyes, Wednesday you'll try the foot, and see which one gives you the most relief. Ideally, again, if there's a problem with the foot and eyes, remember every single joint in your body is located between your feet and eyes. So I always recommend work out your feet, stimulate them, and your eyes together in the morning, in the afternoon, and around supper time, 5 or 6 o'clock. Not before going to bed, 5 or 6 o'clock.
Why?
And
5 or 6?
Because you still want to reap the benefits of the exercises while you're still active at the end of the day. Whereas if you do it when you're in bed, you're kind of wasting the exercise.
Okay.
Right. Remember, it's about reprogramming your muscles, your habits while you're living. So when I'm doing the eye exercises, I'm strengthening my eye muscles. I'm creating more symmetry in my brain, in the muscles of my eyes, on my feet. And I want that to take effect in my body. And that's going to happen as I move and walk throughout the day, where versus if I'm in bed, I'm going to bed. Sure, you'll have the benefits, but you're not starting to retrain your muscles.
So if somebody says they're going to try a session with you online, then so are you managing their pain, and you're resolving it, or they have to meet with you several times or one time? How does that work for somebody who's...
So again, everyone's different, but typically, even in Montreal, when someone comes into my clinic, I don't see someone more than 6 times a year.
That's max. Okay.
So that's max. And usually by the 3rd time, we're pretty much settled. So I would say at least try it once. If you're healthy, you have no issues, 3 times maximum. And if, there's a really big problem, probably 6 times.
And it probably depends on how disciplined the people are to do the exercises what in
That
between visits, right?
that as well. I mean, that is something that I can't control. I mean, we can meet 10 times, but if the exercises are not performed, we're not going to get the results.
Yeah. Tell me a little bit about the insoles because, and I have to try these because I have to see what they're all about. But as I understand, they're different. They're not just insoles. You explained to another podcast I was listening to it as a certain height, or how is it different than what somebody may just get from their orthopedist?
Okay, so what we know from science is that within our skin we have these little sensory receptors that are called mechanoreceptors, and these receptors respond to touch, pressure, pain, stretch, and whatnot. And what we know is that depending on whether I apply pressure or remove my finger, some of these receptors are going to fire to my brain depending on the pressure that is being applied, how long it's being applied for. Now, if the pressure of insoles, for example, in your shoes or the shoes that you buy, they all have this default arch in it, or you'll wear an arch that actually supports your foot. What ends up happening is that some of these receptors actually stop producing the signal. They kind of go numb. So from a muscular perspective, what that does is that it actually weakens your muscles. So using this knowledge, I said, well, what can we do to stimulate the muscle instead of weakening it? Mm-hmm. So the threshold is 3 millimeters of height. So when you go below 3 millimeters, you're actually activating those mechanoreceptors in the skin, and you're creating better postural stability. So in other words, your feet are sensing the ground much more than if it was above 3 millimeters. So we are using height on different places in the insole, but we're also using texture and frequency, all of which target different types of mechanoreceptors under the skin of the foot. So we're using the skin of the foot as a doorway to the nervous system.
So then would this be something that people use only when they need to wear a shoe, and you would recommend them to walk barefoot instead?
So I love barefoot, but it's going to depend on the context. Are you in so much pain that it's affecting your life? Are you popping medication for the last 3 months and you just can't get out of bed? What is the situation? The situation is different for all. Are you someone that's just looking to do this as prevention? Everyone's context is different. Just there are ways to go about each case individually and according to their own schedule and what they feel comfortable with, of course.
I see. Okay. So I noticed on your website that you have trained plenty of people around the world. So I'm just thinking of those people in Europe or Asia, and, because not everybody's in North America. Is this something that they can actually call these people, walk into their office and have a meeting with them if they wanted to see somebody in person?
Absolutely. Absolutely. Okay. You can find all the practitioners on our website and just select where you are on the map and contact them.
And these are people who learned your method, trained with you, and we can trust them.
Yes, absolutely.
Okay. And if not, we go directly to you and say, okay, so that's super interesting. Now, I want to open up the mic to Luke, but before I do, I want to ask, so we're talking about chronic pain as well, right? We're not talking about just acute pain. So people who have osteoarthritis or hip impingement and these things, you're able to resolve these, get to the root cause of the problem? Or is there a point where you go, you know what, there's nothing else we can do. We tried it and you got to go get surgery?
Yeah, so I never, if they're scheduled for surgery, I mean, if the doctor says that surgery is needed, then surgery is needed. Then I would recommend definitely fixing your posture pre-surgery, and post-surgery is definitely something that would be recommended. But what I'm proposing is prevention. Don't wait till you have pain. If you do have pain, again, just trying those 2 exercises, eye exercises, foot stimulation, will give you a window into whether or not this type of treatment is for you. If you respond positively and there's a decrease in pain, I mean, enough to say to go from 10 to 1, for example, this might be something that, you may want to look into, because here's the thing. When there's pain, there is always an imbalance with the feet and eyes. You
Mm-hmm.
cannot have pain without having an imbalance with your feet or your eyes. And also with the jaw, maybe.
And
right?
that's even, and so you're saying this is even with people who've got no more cartilage left, bone on bone, and they're able to resolve their pain, or is there?
Well, bone on bone, again, everybody's different. I mean, how much bone on bone are we talking about? If surgery is needed, at least make sure that the joints are aligned, because even if you go through surgery and get full knee replacement or hip replacement, you're still going to be unbalanced. You're not going to have pain anymore in that joint, but the other side will end up taking the slack 2 years later. Plus, you'll have a scar to worry about, because that scar, if it doesn't heal properly, it's going to cause a postural imbalance in the long term. It may cause an imbalance in the long term. So it's going to add a problem on top of a problem, because surgery does not fix posture. It just replaces the joint that is sick, puts it in a prosthetic piece there, and it doesn't fix posture. It doesn't fix the cause. It manages the symptom.
How much do you think stress plays in people's pain and perhaps misalignment? Because it seems that there's this mind-body connection that you understand. And would somebody who's working on their stress perhaps find that balance as well, and that would help with their pain? Or could that be a contributor, or where does that play a role?
So it's huge, because I mean, our ability, we cannot eliminate stress. What we need to train is how we're going to respond to the stress that we're faced with. Now, what yoga does and breathing does is that it stimulates not only your vagal tone, but it also creates connections. And MRIs actually show this. It lights up the front part of your brain, which is the frontal lobe. Now, one of the roles of the frontal lobe is to inhibit the limbic system. Now, guess what activates the frontal lobe? Your feet and eyes.
Yeah. Right? It's the feet and the eyes.
I'm not saying it's part of, it's never just one thing. It's just part of the puzzle. Yeah. The body needs to be looked at and treated globally. Everything plays a role: feet, eyes, emotions, nutrition, hormones, their daily activities, and so on and so forth. So all of that together is just, what can we do to make all of that better? So can it help? Is stress a problem? Absolutely, 100%. We need to learn to manage our stress. But on top of that, if we're stressed, we clench our teeth. And we spoke about before what clenching your teeth does to your posture. Never mind grinding your teeth and wearing out your teeth. The more you wear out the height of your teeth, the more you change the position of your joint. And you end up having what is referred to as a premature contact, which means that instead of your teeth coming into contact together, the back will end up hitting first, and then you'll have this kind of boom, 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 boom. Well, what ends up happening is that your brain has to constantly manage this position, this premature contact, and it does so by creating abnormal contraction of your jaw. So your jaw muscle, headaches, your neck, your shoulder, your pec, your traps, all of that is going to be in a state of constant inflammation. Never mind the fact that the jaw affects the vestibular system and so on and so forth. So basically, it's a loop. One affects the other that affects the other. So let's propose a solution to try to address all of it together in conjunction to what you're already doing right now. Don't change anything that you're doing. Just add another minute and a half to your routine and work by process of elimination. If you're really curious to find out what is causing what, then I really propose that you do try those different exercises to see what works best for you.
And we can find those on your website, on YouTube. Anywhere else can we find those?
In person or online with me. Yeah, sure. I mean, I do a lot of videos so that people can try it at home. And read the comments in some of the videos that I did. I mean, a lot of people are also saying that they're trying it, they don't understand it, but it's helping them with their pain.
Yeah, it's incredible. I keep trying to pin down, like a typical person, what's the one thing to do, or what's the one root cause, or what is we all want to pop that magic pill. So, but what you're saying and what I'm hearing is it is a holistic approach. And that's where when we work with you or with somebody you've trained, they look at it from all different angles rather than the osteopath who's just going to, give you a deep tissue massage or something or try to crack your back. So have I understood that correctly?
Yes, correct. It's just that we're looking at the body globally instead of looking at the problem locally.
Yeah.
And to try it out, the takeaway message from this is it's not complicated. Just do some eye exercises for 20 seconds, 30 seconds ideally. Rub the skin of your foot, stop clenching your teeth. That's it.
Great.
That takes less than 3 minutes.
And if someone here is listening, is a practitioner of some kind and wants to learn, they tell us a little bit about your course that you're offering.
So all of our courses have the same tone, which is basically brain-based, but we've geared them towards different parts, whether it be learning about primitive reflexes or just the mechanics of the foot, or just an introduction to a brain-based approach in the context of movement. But all of our courses do teach this brain-based approach as far as where you are at in your professional practice, and they're available on our website. And they're as affordable as $97 all the way up to our full program, which is called the Posture Pro Method. And we do offer installment plans, so they don't have to be paid. You can have access to them right away, and then pay them as you go in 4 or 6 installments.
Okay, that's so great. So we can find that on posturepro.co. Not .com, .co. And yeah. And the same thing with your insoles and lots of information on your website. And I will have the links to your Facebook, your Instagram, and it's usually always Posture Pro. We should be able to find you now.
Except Twitter, which is posture_pro. But yeah.
Okay.
So, but
Thank
yeah,
you.
Facebook and Instagram is usually
and
good.
And
Thank
YouTube,
you.
go to those YouTube.
Yes.
So Luke, would you like to unmute and ask your question or make a comment? I'm not sure if you're familiar with Annette's work.
Hey, Luke.
Hey, Annette. I'm very familiar. I'm fine. How are you guys?
Yeah, we're good.
Actually, I'm very familiar with work with Annette because I started working with her method in 2019, and I really got brilliant results from it.
Thank you.
So you were a client, or you somebody working with clients?
I started like a client, and later on I took the course brain coach, and all the cheapest one. And after taking the courses, I was trying to fix my posture because I work like in the fitness industry, and I noticed like people having lower shoulders, something like they cannot do exercises properly, like moving kind of weird way, find the disbalance in the body, and I didn't know why, and actually it's mostly because of feet and eyes.
Ah, interesting. So how long did it take you to resolve the issue that you started off with?
For me personally, it took several months, but I didn't have that time insoles. And after I got the insoles, I'm wearing them on daily basis, and then I see much better. Like the posture is getting more extended, and it helps me also with working out. I don't have any pains. Like my body is stand where it's supposed to stand. So any workout, it's much better. Like I can feel more, sense my muscles better even. It's very interesting how this works.
It's science. It will be, I believe that in 20 years, it will be the new norm.
Mm-hmm.
Thank you so
Yeah,
much,
exactly.
Luke. You know, I think that with Luke and some people, the reason I suggest eye exercises first is really because, again, I try to make people save money. But if there is an imbalance with the foot, what one has to understand is that the imbalance in the foot is always going to create imbalances in body and body
Yeah, exactly.
tension. So doing the eye exercises is going to help. It is, but it's just going to be a slower process for you to get, how can I say, for you to get that 100% that you're looking for. And then once the insoles are incorporated with the eye exercises, if this is something that you'd be interested in, usually the process is much quicker. And again, don't forget, the jaw also does play a role. I don't like to talk too much about the jaw because it kind of freaks people out, and they, you know, they think it has to do with
Yeah,
you know, it's
exactly.
reserved for dentists. But it's important that throughout that process, you stop clenching your teeth. And what I keep on seeing, I know that it works. And how do I know that it works? Because I've been doing it since 2006. If you just perform these exercises, you will have results. How much pain will you be able to fix? No one can tell. It really depends on your lifestyle, and it really is individual based.
That's
Yeah,
excellent.
exactly.
Excellent. Well, thank you so much, Luke, for your input. It's always very interesting to hear other people. And Annette, before I let you go, is there any last words you have for a woman over 50?
The over 50 going into that second part of your life would be the stress management. The stress management, because it will make just the process of going through menopause, which is inevitable, it will just make that process that much easier and smoother to go through. Constant inflammation in the body is no good for anyone, and we really want our adrenals to be loved and to be able to take over when our ovaries are taking a break. So that would be my message. Just try to take some time to relax. Meditation's great, but try incorporating exercises that are going to target your primitive brain so that you can give yourself the best chances at aging gracefully.
Thank you. Oh, those are great, wise words, and I will take them on board, because menopause can be a smooth, effortless transition, right? So thank
I love
you.
it.
Yes,
Thank
it
you
can
so
be.
much.
Thank you for sharing your time. Everyone who's
Thank you.
listening, they can get a discount of 15% off using the code ZORA on any of your online courses. And I would love to hear back from you. If any of you reach out to Annette for a consultation, or any of her practitioners, or try the insoles, let me know. I will be trying the insoles. I'm super excited. I will report back. I would love to have you on as a guest again, and here, take on to the next level, hear more about the jaw, and, and more pain-free lives.
Thank you so much. It was a pleasure, and thank you for your time.